Hello guys, today we can discuss about ataxia. Ataxia is a term for a group of disorder that affect coordination, balance and speech. Any part of the body can be affected, but people with ataxia often have difficulties with balance and walking, speaking and swallowing. Ataxia describes a lack of muscle coordination during voluntary movement and inadequate postural control. Ataxia usually results from a damage to a cerebellum and its connection. Ataxia may be acute or chronic. Conditions that cause acute ataxia are acute infection, post-infectious inflammatory conditions, toxins, tumors, trauma. Conditions that cause chronic ataxia are brain tumors, hydrocephalus, congenital malformation, hereditary ataxias. Conditions that cause recurrent ataxia are toxic injections. 80% of children with acute ataxia are having acute cerebellar ataxia or Guillain-Barré syndrome. Types of ataxia. Ataxia is caused by damage to different areas of the central nervous system. It is characterized by the specific part of the brain most affected, including cerebellar, sensory, vestibular. Cerebellar ataxia. It is the most common form of ataxia. Symptoms are changes in your voice, dizziness, fatigue, headache, muscle tremors, slurred speech, trouble walking and void gait. Sensory ataxia. Sensory ataxia is a result of damage to the nerves in your spinal cord or your peripheral nervous system. When you have sensory ataxia, you have less sensation in your feet and leg from the nerve damage. So you have less feedback from your brain telling you where your body is in relation to the ground. It is also called proprioceptive ataxia. Symptoms of sensory ataxia include difficulty touching your finger to your nose with closed eyes, inability to sense vibration, trouble walking in dim light, walking with a heavy step or stomping when you walk. Vestibular ataxia. Vestibular ataxia affects your vestibular system. This system is made up of your inner ear and ear canal, which contains fluid. They sense the movement of your head and help with your balance and spatial orientation. When the nerve in your vestibular system are affected, you can have the following problems: blurred vision and other eye issues, nausea and vomiting, problems standing and sitting, staggering when you walk, trouble walking in straight line, vertigo, or dizziness. Causes of ataxia. It can be genetic, acquired, or idiopathic. Genetic, you can inherit a certain mutated or changed gene from one or both of your parents that cause ataxia, or you may inherit a mutated gene that cause a disorder with ataxia as a symptom. Acquired cause can be brain tumor, brain hemorrhage, cerebral palsy, chickenpox, hydrocephalus, head trauma. Idiopathic. The most common idiopathic ataxia is called multiple system atrophy. Diagnosis. Diagnosis can be done by history taking and physical examination and by exclusion of other causes of ataxia. Neuroimaging is necessary to rule out the acute life-threatening causes such as tumors and or hemorrhages in the posterior fossa. Head CT obtained to rule out life-threatening causes. It is normal in acute cerebellar ataxia. MRI provides better detail to visualize the posterior fossa for evaluation of other causes of ataxia. Management. Management is always supportive. Physical therapy and speech therapy is often needed. And thank you.